Hello everyone and welcome back to MediNotes for Medicals. The topic that we're going to deal today is about biotransformation from general pharmacology. The objectives we are going to deal is introduction, chemical pathways, phase 1 reaction, phase 2 reaction, phase 3 reaction, induction, enzyme inhibition and first pass metabolism. So what is biotransformation? So as human beings, they intake different sort of drugs. These drugs needs to get easily excreted from the body. So what happens is a particular series of reactions occurs by various body systems that causes a chemical alteration, making it more easy for the drugs to get excreted from the body, which is mostly done in the liver. And this chemical alterations that occurs is known as the biotransformation. So there are three chemical pathways involved, that is phase 1, phase 2 and phase 3. In phase 1 it is known as the degradative reaction. Here it mainly is microsomal metabolites which might be active or inactive stage. It is also responsible for the alteration of the lipophilic drug chemical reaction. So five stages occurs over here. The drug can either undergo oxidation, reduction, hydrolysis, cyclization or decyclization. We know what is oxidation. It is the addition of oxygen or negative radicals and removal of hydrogen or positive radicals. And for example, this basically takes place in cytochrome P450 and its family like CYP3A4 and etc. So an example of oxidation would be phenytoin, theophylline, etc. Now we go for the reduction. It is known as it performs opposite to the oxidation reaction. It involves the cytochrome P450 enzymes mainly. The examples are warfarin, chloramphenicol, and chloral hydrate, etc. Now we go for the hydrolysis. In hydrolysis, what happens is the cleavage of the drug occurs by uptaking of a molecule of water. For example, when the main thing is here over seen over here is ester plus H2 in the presence of esterase forms acid plus alcohol. This is seen in the drugs like aspirin, oxytocin, procaine, etc. And we see the cyclization reaction over in the phase 1 reaction. It forms a ring structure out of a straight chain structure. For example, in the case of cycloguanyl drug, it is obtained from a proguanyl. Now when we go for decyclization, it occurs the opposite way around. Here this ring structure is formed into a straight structure. For example, in the case of barbiturates and phenytoin, etc. When we go to phase 2 reaction, this is a synthetic reaction. It involves inactive metabolite. Here the compounds undergo conjugation, which causes the compounds to get pharmacologically inert and water soluble, making it easily excretable from our body. In drugs such as oxazepam, it conjugate with glucocoronate. When we have the phase 3 reactions over here, which follows the phase 2 reactions, here the conjugated metabolites are excreted from the cells. Now a drug would undergo either inhibition or induction based on the drug profile and the CYP enzymes present. So enzyme induction means CYP enzymes are basically getting induced over here. This causes a drug-drug interaction. This would lead into a therapeutic failure. For example, if a patient is taking rifampin along with imatinib, the plasma concentration would get reduced because rifampin, it induces the CYP3A4 activity and it metabolizes imatinib at a much faster rate. So what happens is that the imatinib anti-cancer activity would get attenuated because of it. When we go for the enzyme inhibition, the opposite thing happens. Here the CYP enzymes are inhibited. So what happens is that when a patient, suppose, is undergoing gastroesophageal reflex disease and is under the treatment of omeprazole along with imatinib, the imatinib concentration would increase because omeprazole is a potent inhibitor of CYP3A4 enzyme, which is a metabolizer of imatinib. This causes the accumulation of imatinib, leading to toxicities. Next is the first pass metabolism. Here this mechanism or this metabolism occurs before a drug enters the systemic circulation. And this, as soon as it enters the systemic circulation, it gets inactivated. Some of the mode of route of administration that would lead to first pass metabolism is IV, sublingual, and transdermal. Why? Because it has increased bioavailability. When you see the diagram over here, the drug that has been intaken by this patient, it has two routes basically, to go via stomach directly to the lumen of GI tract, or to go through the liver region. So in first pass metabolism, this would directly go to the liver, from which it goes to the general systemic circulation, as well as from the hepatic portal system it would go to the lumen of GI tract. So that was the video for today. I hope you like this video. If you like this video, don't forget to like, share, and subscribe to our channel. We'll be coming with more videos. This is Ashna Viraju signing off for today. Bye.